Welcome to the Pacific Research Institute's Next Round podcast. I'm Rowena Itchon, Senior Vice President, and with me, as always, is Tim Anaya, Senior Director of Communications. How are you, Tim?
I am great. How are you?
Fine, thank you. So you're following the suspense bills in Sacramento.
Yes, so for our listeners who may not be familiar with the legislative process, we're in the midst of the final weeks of the legislative session, and all bills have to pass the legislature by midnight on August 31st, or else they're dead. And that's when the legislature adjourns for the year, and we can all breathe a sigh of relief. So last week was what they called the suspense file hearing, and I won't go too much into the weeds of it, but essentially all bills that cost any money are put together on one list, which they call the suspense file, in the Appropriations Committee. And the Appropriations Committee looks at the fiscal impact of every bill. And so what they do is essentially they consider all the bills that have any fiscal impact all together in one big list, and then they decide which ones to move forward. And in many cases, the bills are amended to reduce the fiscal impact of the bill. So right now, there are about 1,000 bills after the suspense file hearing that the legislature will be voting on between now and August 31st. So there are about 378 in the Assembly and 639 in the Senate so far. Now, the suspense list they went through, and about 75% of the bills that were on the suspense file were passed out. So what are some of the interesting ones? Well, one that I have found interesting is this bill, AB 1577, that would basically allow legislative workers to collectively bargain and potentially have union representation at the Capitol. And, well, people don't really have a lot of sympathy for the plight of legislative workers. Having been one, I can tell you it's actually, for all the warts, it's a pretty good job. Yes, you get to deal with a lot of, let's just say, interesting characters, both the people you work for, the people you work with, and members of the public. But for all the long hours and kind of goofy things you have to deal with, it's not digging ditches. So I don't really see that having a union will do anything other than siphon off some money from folks to pay union dues. It certainly wouldn't have made any of the much publicized issues in the legislature with bosses behaving badly, wouldn't have made any difference in those cases, I would argue. And certainly Republican staff who make a third less or more than their Democratic counterparts, and there are certainly a lot fewer Republican staff than Democrat staff, certainly wouldn't address their pay disparities. That bill is moving forward, and we will see what happens to that one. There's another pay bill that's interesting, and I know, Ro, you have been kind of following this issue, and it's a bill kind of getting at gender and pay disparity. It's a bill by SB 1162 by Senator Monique Limon, and the bill would have required not only basically public pay data to be reported by many businesses to the state, breaking it down by the position and race and gender, but it also would have required salary ranges for the positions that are being advertised to be filled, and it would require companies to publish pay data for the contractors that they contract with. Well, the bill was heavily gutted, and so the bit about the reporting the pay by position, race, and gender, that's been gutted from the bill. But the provision about the salary ranges and contractor pay data, that has been included. Now, when I worked in the legislature, there was a salary range, well known for all the different positions. And that didn't really help me in my quest for better pay. I always made less than even the lowest range of the salary ranges. So, the hope is that, you'd get better pay if there's a public salary range. But in my case, there was, and it didn't really help me. Ro, what are your thoughts?
Well, I'm glad to see that parts of the bill were gutted, because that data that corporations were supposed to collect on race and gender wasn't supposed to be made public. It was going to be reported to the state. And even the EEOC said this data should not be used to evaluate disparities among race or gender. It just just wasn't designed for that. So I think it would give the public a wrong impression. So glad that went away. On the other side of that, Tim, on your point about the salary ranges being published, on the higher end of it, you're a prospective job candidate and you saw that the position was capped at 75, 80,000 and you wanted to make more than that. The company wouldn't have any negotiating ability and you would walk away from that job and maybe you would have taken it for, 85 or 90. But the company had already set that range in place and published it, and their hands would be tied. They're not able to hire the best candidates and have a little more flexibility on the pay that they could give to an employee. And I would say that, is that really necessary? Look at all of these fantastic websites now that offer pay ranges depending on your location. And anyone who is looking for a job can easily go to one of those sites based on those ranges for those various jobs and the location. They can decide whether they want to ask more, from their employer.
And we know, of course, this bill, well, given the track record of recent leaks, we know that data that wasn't supposed to be made public would have been leaked. I mean, it's inevitable that it would have happened. And then there would have been questions of, if you're involved in litigation, could you subpoena that data? But the other thing to me that really all these bills come down to, it's always kind of the Full Employment Act for lawyers. Employment attorneys would have had a field day filing cases, trying to get this data. It really would have led to more lawsuits, I think, and probably wouldn't have done much to help those employees who are not getting, the salaries that maybe they should be getting. The other bill of interest that we haven't talked a lot about much here, but it is a huge issue. And this is a bill about what is the culpability of social media companies for whether it's algorithms or products or services or new apps or what have you that really target young people and really, you could argue, get them hooked. And there was a bill. It was a bipartisan bill by Assemblymember Jordan Cunningham of San Luis Obispo and Assemblymember Buffy Wicks of Oakland that would have given public prosecutors the ability to bring civil lawsuits against social media companies for putting out these kind of apps or features or products that they know would get kids hooked. It was probably one of the most controversial, one of the most talked about bills of the year. Originally, the bill would have let parents file civil lawsuits in these incidents. That had been previously stripped of the bill. Well, that bill was killed in the suspense file, so that will not be moving forward this year. And I guess it shows the power of certainly the social media companies and the tech community here in Sacramento. But it's not an issue that's going away. More and more people are critical of how social media companies are handling a lot of things: privacy, data, algorithms, discrimination, putting the thumb on the scale to promote one viewpoint and silence other viewpoints. We'll see what happens next session, but for now, that bill has been defeated.
Well, Tim, the president is expected to sign the Inflation Reduction Act this week. It passed both the Senate and the House. And for our guest, we have Sally Pipes, president of PRI, to address the bill's impact on healthcare and pharmaceutical drugs. And we'll also have Wayne Winegarden, Senior Director of Business and Economics here at PRI, to talk about the climate change provisions of the bill. Listeners should know that we're going to be watching this bill closely in the next few months and years ahead and figure out ways we can chip away at it and even try to reverse it.
Well, if you were confused by the coverage of the past week, I found it interesting that all the talk of the bill was the quote Inflation Reduction Act, and then all of a sudden after it passed, it was the climate policy and healthcare bill. So if you're wondering what actually is in this bill, stay tuned, because Sally and Wayne really break down what this bill means, what it would do, and how it will impact you.
Tim, what Sally and Wayne didn't have time to address in their discussion is this issue with the huge cash infusion, $80 billion to the IRS, half of it going to crack down on tax evasion, subject of my blog this week. The Democrats, of course, intended to go after the wealthy. But the fact is that, whenever government wants to fund these massive spending projects, the problem is there just aren't enough rich people around to fund them. So they have to go into the middle class and the working class. And sure enough, according to an analysis by House Republicans, small business owners and Americans who earn less than $75,000 are slated to receive 60% of the additional tax audits that are expected to come out of this package. And that's more than 700,000 additional IRS audits. And all this to raise $124 billion in more revenue for the government.
I was having dinner last week with my former boss, who we have humorously christened CCC, now Congresswoman Connie Conway. And she was telling us she just had the opportunity to go on a tour of the border to see what's going on down there. And she said, and, it kind of certainly is shows you where the priorities are. She said, well, thinking about this whole issue, maybe instead of hiring 87,000 more IRS agents, we should hire 87,000 more Border Patrol agents. Maybe there's something to that.
That's right, Tim. So thanks everyone for listening. And here's Sally Pipes and Wayne Winegarden. Welcome to Next Round, Sally.
It's a delight to be here to do the podcast. There's a lot going on with healthcare, as we saw the passage on Friday, August 12th, with the Inflation Reduction Act, which, of course, that's a misnomer because it's an inflationary increase act.
So, Sally, much of the discussion about the so-called Inflation Reduction Act focused primarily on climate change and energy. There's actually significant provisions in the bill related to healthcare. So let's go through them. First, the bill addresses the scheduled end of Obamacare subsidies at the end of the year. What will the bill do for Obamacare subsidies? And in your view, what will be the impact on the costs and the quality and availability of healthcare?
Well, as it turns out, this Inflation Reduction Act has a tremendous amount about healthcare, it's even more than was in the original Build Back Better bankrupt act, as I like to call it. So, it's a $739 billion increase in revenue, including $288 billion. There'll be reduced spending because of the drug price negotiations under Medicare. There's $433 billion in new spending. So if we look at the Obamacare subsidies, under the American Rescue Plan that was passed in March 2021, there was an increase from 400% to 600% of the federal poverty level where people would be eligible for those subsidies. The subsidies were to expire under the American Rescue Plan on December 31st, 2022. But under the new Inflation Reduction Act, these subsidies are going to be continued until December 31st, 2025. And as I like to say, nothing endures like the temporary. And so if it goes till 2025, this will probably be a permanent expansion. The cost of the expanded subsidies is about $64 billion a year. And it's really helping people that already have health coverage and they don't need these subsidies. So it's really, I think it's a stepping stone approach to single payer healthcare. A family of four earning $212,000 a year under this expansion will be eligible for $12,000 in subsidies. This is just a further expansion of trying to get Bernie Sanders' Medicare for All into the American system.
So perhaps the bill's most controversial provisions would give the government the power to negotiate prescription drug prices for Medicare patients. So how would this work? And in your view, how would giving these new powers to government negotiators impact the prices we pay for drugs at the pharmacy, the availability of life-saving medications, and perhaps most troubling, the development of cutting-edge new treatments?
Well, this is a very important point that you raised, Tim. Under the bill, they passed the ability for Medicare, HHS, to negotiate drug prices with the drug manufacturers. Interestingly, the program will not come into effect for 10 of the top drugs until 2026. So it'll only be for 10 of the top drugs sold under Medicare Part D. The second part is that that number will go to 15 drugs in 2027 and 20 drugs by 2029. But this is really a system of price controls because the government will be determining the price of these drugs. Now, under Medicare only, not in the original bill, it was going to affect the private sector too. But now, under this Inflation Reduction Act, those drug companies that don't follow what the government says the price is, they will then be subject to a 95% excise tax on that drug. So this is going to have a tremendous impact on research and development. As Thomas Phillipson at Chicago said, this program will cost $668 billion in lost research and development by 2039, and the fact that 135 new drugs will not be coming to the market. The small molecule drugs will get a 9-year reprieve after FDA approval, and the biologics will get a 13-year drug. But this will be these price controls will affect the most common drugs that people on Medicare have access to.
So, Sally, the Democrat proponents of this provision believe that these changes would be very popular politically. But according to a survey and focus group research that PRI commissioned, it may not be as popular as Democrats may think. What does PRI survey data tell us?
This is a very important point because the American people, when they are surveyed, particularly voters, when they're asked whether Medicare should base its drug prices on decisions made by government bureaucrats, such as is the case in Canada and in the United Kingdom, nearly 60% of voters oppose this. So it's going to be very interesting to see when this all comes into being in 2026. The other point is that nearly 78% of voters oppose government setting drug prices based on quality adjusted life years, where the government actuaries would be determining who is eligible based on their age and their income level for these new drugs. And more than 72% of voters said that they do not agree with the House and Senate Inflation Reduction Act, formerly the Build Back Better Act. So the voters are not in favor of this. But I think the reason it went through so easily when Senators Manchin and Sinema signed on to this, which has so much to do with healthcare reform, it's really not about the policy, it's about politics. It's a huge hit on the middle class. As we know, a lot of people earning under $200,000 are going to be really hit by higher taxes.
So you've continually made the case about how destructive government-run healthcare proposals would be for America's patients. So if you were advising members of Congress today, what would you encourage them to do to address these problems of affordability and accessibility in healthcare without this latest expansion of government into people's healthcare?
Well, I've been a strong proponent of consumer-based healthcare, empowering doctors and patients and not the federal government. Here in the U.S., Senator Bernie Sanders has been pushing Medicare for all for practically from when he probably was born. This is his lifelong goal. This Inflation Reduction Act is just a stepping stone approach to what he really wants. But the American people want choice. They want competition in all aspects of their life, including in healthcare. And so, I grew up in Canada under single payer. The average wait in Canada today from seeing a primary care doctor to getting treatment by a specialist, 25.6 weeks, almost half a year. There's a shortage of doctors. Healthcare is not free. The average Canadian family pays over $15,000 a year in hidden taxes for a program where they have to wait. So I want to open up the market, give people more choices. I support the idea of the personal option rather than the public option. We need to expand health savings accounts, which put people in charge of their health care. We need to expand the amount of money an individual or family can put away each month and allow health savings accounts to be used by people who are on Medicare. Currently, people on Medicare can't put money away into their account, but this money is put into the account, into your bank account, and it's carried forward tax-free. And it is a very good way to make people more responsible about their healthcare spending. We want to expand short-term limited duration plans, which President Trump approved when he was the president. Many states have disallowed them, including California, New York, where the governments in these states do not want people to be able to buy a healthcare plan that suits their need. These are particularly good for young people who may be between jobs or just would like to be able to have coverage when they have a catastrophic situation. You could contribute to a short-term limited duration plan for 1 year, renewable up to 3 years. And this is a tremendous way to put people in charge of their health care. Telehealth is another issue that I've been promoting for many, many years. And of course, during the pandemic, telehealth came into being because people couldn't leave their homes or go to doctors' offices. So it's become very, very popular. And it's a great way to put people in charge. And it reduces the cost of healthcare because people don't have to get in their car, wait in a doctor's office. Telehealth is a terrific way to put people, as I say, in charge. We need to expand scope of practice, which allows nurse practitioners and physicians' assistants to do a lot of the work that doctors do, that they are trained to do, and it helps also to reduce the cost. There are about 28 states now that allow scope of practice, NPs and PAs, to do the kind of shots, to do measuring blood pressure and things, and it reduces the cost of healthcare. So those are some of the things that will open up and put doctors in charge of healthcare instead of taking us down a path to single payer healthcare where there will be no off ramp, and we will not be able to get rid of the whole takeover by government of healthcare plan. As Milton Friedman used to say, show me a government plan that comes into being that is ever ended. And it's very, very rare. The Mohair Subsidy Act is one, but very, very few. So we've got to be able to work hard to educate on why these ideas are bad for the American people and for their health.
Thanks so much, Sally. And now next up is Wayne Winegarden, who's going to talk about the climate change provisions and other environmental issues with the Inflation Reduction Act. Welcome back to PRI's Next Round podcast, Wayne.
Oh, thanks for having me once again.
So the Democrats have titled their legislation as, quote, the Inflation Reduction Act. But it really seems like it's just billions of dollars in new government spending. So will this legislation really reduce inflation? Will it really help the economy?
No, it will neither reduce inflation nor will it help the economy. The Inflation Reduction Act is a branding exercise that takes the policies that they wanted to do from the very beginning of this Congress and basically stuffed it through. If you actually measure or judge the act based on the theory, the economic theory, they say, you know for sure it won't reduce inflation, because the theory is that if you're going to reduce the deficit, then you're going to have you help reduce inflation. And there's some merit to it, but the problem is you have to reduce the spending, not just through raising taxes. But if you look at the CBO score, and the CBO score says that the bill will reduce the deficit over 10 years. And that's the catch, over 10 years. Over the first 4 to 5 years, it increases the deficit. So if you're saying your bill is going to reduce inflation because it reduces the deficit, but you don't get any deficit reduction until 5 years into it, it's really hard to try to imagine how it has any disinflationary impacts. In terms of the economy, what you're really doing is you're harming the really innovative pharmaceutical sector. You're expanding subsidies in healthcare, which is going to also harm the healthcare sector. And you're wasting money on all sorts of subsidy programs and quote unquote clean energy programs, which aren't new, right? We've had a $7,500 electric vehicle credit for, dozens of years. We're going to re-up it and expand it, but it's nothing new. So all we're doing is subsidizing a very unproductive industry. And that's really the bill in a nutshell, which is why it's going to actually reduce growth and actually worsen inflation.
So if the Inflation Reduction Act is not good policy, then what would you advise Congress to do instead that really would have the most meaningful short and long-term impacts on reducing the economy and helping to rescue an economy in recession?
To reduce inflation, what we need to do is two things. One is already being done to some extent, and that is the Federal Reserve has to tighten monetary policy. It's doing that, and so that is helpful. And we'll start to see the benefits, later on this year from those actions. What the federal government can be doing to help reduce inflation is expanding the productive incentives on the supply side of the economy. That can be done through deregulation, which would be very important. That should be done through ideally tax reform, certainly bringing down spending, right-sizing the budget. All of these things that would reduce the government's negative impacts on the economy and expand the private sector's ability to produce and the incentives to invest, save, work, all of those supply side concepts that we actually desperately need right now. One of the most important areas that they could be doing is with energy deregulation, where the most talked about kind of pipeline that's been canceled is the Keystone pipeline. And that actually reduces our infrastructure, reduces our ability to get oil and natural gas. In this case, it's oil and natural gas developed in Canada to market, which would actually bring down further oil prices, bring down gas prices, help energy become more affordable. We really need that type of approach throughout the U.S., where we need lower restrictions on permits. We need more pipelines built. We need greater incentives for all those things. And we need reforms to things, the regulatory burdens that allow lawsuits to constantly kind of muck up that process and keep viable and very important energy projects from ever getting started. All of that type of regulatory reform would both help improve economic growth and through that support the Fed's efforts of disinflating the economy. Now, all of that I just said, I wouldn't expect the current administration to support. I wouldn't expect the current Congress to support. But that is what we should be doing rather than expanding the size and scope of government, which is what the approach we're taking is.
As an aside, there's been a lot of discussion among pundits about the Biden administration counseling the media and others not to say that America is in a recession. So what's your view? Are we in a recession? And do you think that semantics really matter?
When I think about the current debate, I really think about President Reagan's kind of quip about recessions, which I think is brilliant and completely applicable to our current environment. And what President Reagan said is, a recession is when your neighbor loses his job. A depression is when you lose your job. And recovery begins when President Carter loses his job. And I think there's a lot of truth to that in terms of where we are right now. The economy is very difficult for far too many families. The inflation that we've seen has eroded our savings. It's eroded our income. And in fact, we've seen strong income growth over the past year, but it just hasn't kept up with inflation. So families are falling further and further behind, facing very tight affordability issues, very tight budgets. And it's hurting people. And we're seeing that in the numbers. Whether or not a group of economists are going to come together and say, oh, does this constitute a recession, I think is not as important, especially because we are in a unique circumstance. And so the economic data is demonstrating that. We're continuing to see weak income growth numbers, right? We're seeing declining GDP, yet we're seeing growing employment. Now, while we're seeing growing employment, we're actually also still seeing a very low employment to population ratio. So if you want to create a story one way or another, there's data out there that you could craft whatever story you want to tell. And I think that's really where this question of whether or not we're in a recession is coming from. But it's also why I think it's a bit irrelevant. The fact that families are hurting, I think, is the most important issue. The fact that the economy is not generating the type of kind of welfare enhancements, and when I say welfare, I mean our individual welfare. That's the bigger problem. The economy is not good. People don't feel good. They're struggling. And to me, that is the most important issue and the only thing that really matters.
One of the major provisions of the Manchin bill is something that you've analyzed extensively over the years. That's, of course, more electric car subsidies. So what's your view of the electric car provisions in the bill? Will working class Americans really benefit from this, or is this yet another giveaway to upper income drivers? What do the initial analyses tell us?
The initial and the longer term analyses, they tell us this is going to be another giveaway to the rich. It's another giveaway to upper income drivers because it has to be, because upper income drivers are the only ones that can afford an electric vehicle. And it's not just because electric vehicles cost $20,000 more than the average internal combustion engine vehicle. And often they're going to cost a lot more than that. But the lack of functionality of the electric car makes it in itself a luxury. That if you're a family that's a family of three or a family of four getting by on lower middle income salary, you don't have the ability to have this car that can't perform as well as an internal combustion engine. All the limitations on your range, all the limitations in terms of how you charge it up. that is going to be in and of itself create problems for a low income family. So by definition, you're really only going to see upper middle income or upper income families purchasing electric vehicles. And that's why when we looked at this issue years ago, we found, 79% of the credits went to the rich. And almost 100% went to people who earned above the median income. It is just a product that upper income families are going to purchase. Now, they're trying to come up with ways to make it attractive or make it useful for lower income people. One of the ways is that they cap the income of people who can use a subsidy, which in my mind, that's great, because if you're capping that income, it just means that the subsidy won't be used very much because low income people still won't be able to afford it. Upper income people won't have access to it. And so I think that's great. So, we're not going to use a subsidy. So that $7,500 credit for a new electric vehicle will be used a lot less. Now, there's also a $400 to $500 subsidy for the purchase of a used electric vehicle. And that's very problematic for a number of reasons. One, the product still isn't of use for lower income families, so you still have that problem. Two, everything about an electric vehicle is all about the battery. I mean, that is where the value is. And so you think about it this way: would you buy a 2-year-old iPhone? And I think most people would say no, beyond just the fact that somebody else's grubby fingers have been all over it. The battery, and we know the battery and the performance and all of those things have degraded significantly. And that's what you see with electric vehicles. So, buying, if you go online and you kind of Google, what to look for when buying an electric vehicle, 6 of the top 10 all have to do with, is the battery still in good shape? And the odds are it wouldn't be. So again, you're going to have a very, very substandard product that you're selling. But what you're actually doing by having that $4,500 credit is creating value for the asset that's already owned by an upper income driver, right? So that before that credit, nobody would buy the electric vehicle. Now, some people might buy it. They would most likely be upper income people. It would probably be devalued to some extent because of the issues I just mentioned, but it would have some value because of that $4,500 credit. And some of that is going to, in order to the upper income driver. So again, what are we doing? We're still subsidizing the rich. And that's the bottom line. If you're subsidizing a product that only the rich can afford, you're going to be subsidizing the rich no matter what types of restrictions or however you try to essentially plan that, those credits. It's not going to make it beneficial to lower income people.
Wayne, finally, much has been made of Senator Manchin's demand that West Virginia and American energy be the priority with the energy and climate provisions of the bill. So in looking at the bill, do you think it will boost American energy supply and reliability? Will it make America more energy independent? Or are these provisions sound good on paper, but the devil's in the details?
I think it's the devils are in the details, especially there's a lot of votes that have to come. And it's really hard to imagine that once they get this bill through Congress, that a lot of the progressives will then turn around and do the types of votes necessary to expand that production. And even beyond that, you still have the regulatory environment and the administration talking about how we want to phase out fossil fuels. So, you still have this overarching hostility that it creates a negative investment environment. I mean, and I guess it's simple. Even with these provisions, would you invest in drilling a new well if with your own money? And there's a lot of uncertainty. So unless oil prices are exceptionally high, it's hard to imagine how that cost benefit analysis would point to doing that. So and I think that's the problem, is that the overarching hostility is still there. The additional votes that would have to occur to really make these things meaningful seems unlikely to happen. And again, that's just the way that they've jammed it through the Senate, right? You had to get it through budget reconciliation, which means some things that Manchin wanted just couldn't be due through reconciliation. So you got the promise of a vote rather than actual policy, which is rather trusting of him. I'll put it that way. So there is still that overarching problem with respect to how we're regulating energy, how we're approaching fossil fuels, that since that hasn't changed, there's not going to be any really meaningful change to energy supply or reliability. And I should also add that if you look about Texas and some of the issues they've had this summer with their energy reliability, and thank God that's not been as bad as feared, a lot of that comes from a high reliance on wind and some of the limitations that can come from these what they call non-dispatchable technologies. So we also have to consider those factors as well, that as we put on more non-dispatchable technologies onto the grid, we're going to be reducing the reliability of natural gas, especially nuclear to some extent. Coal is the most flexible in terms of how it operates in the grid. Of course, it's the one that emits the most greenhouse gas emissions, ironically. But those impacts are going to happen as well. That's going to hurt our energy reliability because, again, the grid is it's a precise system that needs to be well maintained, and over reliant on some of these sources can actually undermine that reliability. So we actually also have the negative impacts on reliability that can come from the continued subsidization of these sources and then the overuse or over reliance on them.
Thanks so much, Wayne. We know you'll be following this law closely in the future. Thanks for your time.
Oh, thanks so much.
If you like this episode, please tell your friends and subscribe to PRI's podcast at iTunes, Google Play, Stitcher, TuneIn, iHeartRadio, and Spotify. And when you're on these platforms, don't forget to give us a big 5 stars. If you don't subscribe to any of these, you can still listen on PRI's YouTube page, youtube.com/Pacific Research 1. That's the number 1. Thanks for listening. I'm Rowena Itchon. Hope you'll come back again for next round with PRI.